Insomnia, sleep apnea, restless leg syndrome, and narcolepsy are all types of sleep disorders. Do you have a hard time falling asleep at night? Do you have a hard time staying asleep throughout the night? These are signs of chronic insomnia. Insomnia really can take its toll on your life. You may experience unrefreshed mornings and a loss of energy early in the day. Some other symptoms might be irritability, depression, or anxiety. Difficulty paying attention, tension headaches, and even gastrointestinal issues might arise. Stress, medication, caffeine, alcohol, nicotine, and even eating too late can cause insomnia. There are many different causes of insomnia. Review any medications with your physician to make sure they are not affecting your sleep. You should stop smoking, as nicotine is a stimulant. Exercise is beneficial for healthy sleep, but not within 4 hours of bedtime. Avoid caffeine intake after 2 p.m. and always take time to wind down. Sleep apnea is a more serious disorder. This is a disorder that causes your breathing to stop or get very shallow during sleep. Each pause in breathing typically lasts 10 to 20 seconds and sometimes even more. These pauses can occur 20 to 30 times an hour or more often. There is obstructive sleep apnea and central sleep apnea. Obstructive sleep apnea is the more common form and occurs when the throat muscles relax and occlude the airway. Central sleep apnea occurs when your brain doesn't send proper signals to the muscles that control breathing. Sleep apnea is a very serious disorder. You should discuss the possibility of this disease with your doctor if you snore loudly enough to disturb others or wake yourself from sleep, you have shortness of breath that awakens you from sleep, you have intermittent pauses in your breathing during sleep, you have excessive daytime sleepiness, or non-restorative sleep. Restless leg syndrome causes a powerful urge to move your legs. Your legs would usually become uncomfortable when you are lying down or sitting. It is sometimes described as a creeping, crawling, tingling, or burning sensation. Movement usually relieves this sensation temporarily. Caffeine, tobacco, and alcohol can make the symptoms worse. Unfortunately, there are no known causes of restless leg syndrome, but it is hereditary. Researchers suspect that restless leg syndrome may be due to an imbalance of the brain chemical known as dopamine, which sends messages to control muscle movement. Narcolepsy is a chronic sleep disorder in which the control center for REM or dreaming sleep and wakefulness does not properly function. Narcolepsy causes an overwhelming urge to sleep during the day, an inability to stay awake for long periods of time regardless of the circumstances, and fragmented or broken sleep at night. Unfortunately, there is no cure for narcolepsy, but with the right treatment it can be managed very successfully. Medications and lifestyle changes can help with the overall management of narcolepsy. We would also suggest advising your family, friends, employer, and others you may be around of this disease so they will be aware of the situation if it were to occur while with them. With narcolepsy, you may also experience a sudden loss of muscle tone or drop attack, known as cataplexy. Sleep disorders can be challenging to live with, but hopefully I have been able to help you better understand these disorders and, more importantly, how to manage them and live life at your best.